Welcome back. You're watching HFO-TV, co-sponsored by AMF Capital, the Ball-Janik Law Firm, and the construction firm J.R. Johnson.
Welcome back to HFO-TV. I'm Aaron Kirk Douglas, Marketing Director, and I am here to talk to you today about Outside In. HFO, as you may know, has been named one of the top corporate philanthropists the last few years in the small business category by the Portland Business Journal. And one of our favorite charities is Outside In. And with me today is Tess Anawalt, the Donor Relations Manager. She's going to tell us a little bit about Outside In and their operations downtown. And last week, Tyler Johnson and I were down there. We took a tour of the facility, and we were excited to learn that they are opening a brand new facility in East Portland. They just broke ground on it recently. And so I thought, what better way for us to introduce one of our favorite charities to you than to have Tess come in and tell us a little bit more about it. So first she's going to start off telling us a little bit of history about the organization and the people that they've been serving in downtown for many years.
Thank you so much. Thank you. I'm excited to be here. So yeah, Outside In is a health and social services agency. We're a medical clinic, and we provide social services to homeless folks, low-income folks, people who are parts of marginalized populations, and we currently have 9 locations providing all of our different services. Our medical clinic is a federally qualified health center, which means we do full comprehensive primary care for people of all ages, and then we're also offering complementary alternative care. We have a very comprehensive set of social service supports for homeless youth specifically, so we work with youth up to age 25, providing a drop-in center with 3 meals a day, case management, housing, employment, and education. So through all of those services, for us it's really about a full comprehensive wraparound support network of medical and social services, and we are working with about 11,000 people a year right now in the Portland metropolitan area.
That's amazing. So thank you.
Thank you so much. Yeah,
for all the work that you do.
Yeah, we're a 51-year-old agency, so we've been in Portland for many years.
And so while Tyler and I were down there last week taking our tour, you told us about this new facility that you just broke ground on. So let's talk about that a little bit.
Yeah, we're so excited. So we broke ground on October 23rd on Outside In's new second clinic location. And it's in East County. It's on 162nd and Burnside. And we spent about a decade looking at where we wanted to expand our services to and where we really wanted to bring sort of Outside In's next clinic to, and identified this area as just a really good fit. So we're super excited to open our doors.
All right. And do you know when that will be?
Yeah, so we are on a 8-month projected timeline for construction.
Wow, that is super short.
I know, it's amazing. So we're hoping to open at the end of the summer, early fall 2020.
Wow.
Yeah.
And what will it mean for the people in that, you said Rosewood Neighborhood?
Yeah, the Rosewood Neighborhood.
What does this kind of a clinic mean for the people there, and is it going to be different than the one you have downtown at all?
Sure. It'll have many of the same services that our downtown clinic does. So the Rosewood Neighborhood is about a 15-block area of folks. We know that there's about 14,000 people living in that area. And it's been identified as a healthcare provider shortage area by HRSA. So that was part of what really informed our wanting to bring our services there. And you know, it's about having a clinic in the neighborhood that's accessible, that folks can walk to. It's surrounded by apartments. It's directly across from a MAC stop, which is really great as well for access. But then another thing about Outside In and our services is that we really do healthcare differently. We have for 50 years been building a process of working with and serving folks who have been unsuccessful in more traditional healthcare settings, or have maybe fallen through other safety nets, who feel unwelcome or unsafe in other medical care settings. And that's, just because of the institutionalization of some medical care, and folks have had different experiences. So Outside In works with people who are more traditionally marginalized, so whether that's homeless folks or low-income folks, people who are members of the LGBTQ community, and have had past experiences feeling maybe unheard or unwelcomed at other medical settings. So for us, it's really about lowering those barriers to care and being an affirming and welcoming space for everyone that walks in. And we really want to partner with our patients and listen to them and work with them and as a team, instead of sort of telling them how we're going to provide services.
And are you expecting to see more families in this clinic?
We are, yeah. So our downtown clinic has, we historically have worked with many folks who are currently experiencing homelessness, and we will of course see those people in our clinic in East County as well. But one of the things is that because we are sort of nestled in between so many families, I mean, there's so many young, multicultural, multilingual, really vibrant, incredible folks who live in that community, but have historically not received many resources. And so they are potentially one major health incident away from losing their housing or really catastrophic results. And so for us to be able to build those relationships that are built around trust and built around honoring the people that we're serving before one of those incidents happens is huge, and is really going to lead to preventing homelessness for many folks. And then we also, of course, do a lot of signing people up for health insurance. That's a big part of what we do. We try through all of our services, again, just to lower barriers, right? So we have walk-in appointments every day. We see people whether or not they have insurance, whether or not they have the ability to pay. So we just want to be somewhere where folks can come that day and get the care that they need. And then we're going to be working with them to get them signed up for health insurance, to kind of build that long-term health relationship that leads to long-term healthy outcomes. And then also, for us in that community, there's so many families, there's so many folks where it's really difficult to get, even if there are other clinics that have access on public transportation, which there's many wonderful clinics in Portland. Just the difference of being able to honestly walk out their doors and walk to Outside In's clinic that's around the corner is going to be huge.
So what can people do to help you with this? What can people in the community and businesses do to help you at this point in time?
So we are still fundraising for the project. We started the fundraising campaign, and we are now sort of in our second big push for fundraising. So it's a $4.5 million project, and we have $1.5 million left to raise.
Okay.
So that's definitely a way that we would love to engage with folks. We actually have a challenge gift that one of our donors has issued specifically for this project. So he is going to be matching all gifts to the project up to $200,000.
Okay.
So that's something we're really excited about.
So a total of $200,000 from a group of people turns into $400,000.
Exactly.
Okay.
And that's on all gifts over $10,000.
Okay.
So, and then we have associated with the project, we have naming opportunities for many of the different areas in the building.
Yeah, I saw some of those. What's the building itself is $1.5 million if you wanted it to be named after yourself.
Absolutely. Part of the way that we do our buildings is it's really about creating a space within the community that feels like it's a part of the community. So we have art that will be going up all around the outside of the building, and then we have an internal courtyard that's going to be, private and an area where folks can come and be in the space. And so there's a naming opportunity associated with the courtyard. We have a conference room that we're going to be using for community gatherings as well. So there's all kinds of stuff.
And so people can, we'll put your contact or the website where people can reach you on the video here, so people will know how to reach you with any
Yeah,
questions
yeah.
about
If
that.
folks want to talk more about the project or specifically around fundraising for it and those different opportunities, I would love to connect with
All
them.
right. Well, Tess, thanks for coming down and talking with us today, and
Thank you.
we look forward to seeing you next time on HFO-TV.
Our entire office specializes in multifamily real estate, making HFO the largest multifamily brokerage in the Pacific Northwest. Your success is our passion. Build your legacy with HFO. Call 503-241-5541 or visit our website at hfore.com for more information.